So I'm Dr. Benjamin Levy. I'm an associate professor at the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial Hospital in Washington, D.C. Not all EGFR mutations are the same, and this is makes things very confusing. I think what we know, about 90% of EGFR mutations are sensitizing mutations in exon 19 or 21. And those are the most common ones that you need to look for in that next generation sequencing report. And those mutations predict sensitivity to tyrosine kinase inhibitors, specifically osimertinib. So I would just be very careful when you're looking at your next generation sequencing report or your liquid biopsies to show that a 19 or 21 is what you're really generally looking for. There's been some data that exon 19 mutations may be more sensitive to tyrosine kinase inhibitors than exon 21, but I don't know if that's necessarily the case. I think both are sensitizing mutations. I think the other types of EGFR mutations that we see are in exon 18 and exon 20. And to make matters very confusing, there are multiple exon 18 mutations. Some are sensitive to tyrosine kinase inhibitors and some are resistant. So if you see an exon 18 EGFR mutation, you need to look it up to see, and you need to look at the next generation sequencing report and its interpretation to see if this is a mutation that predicts sensitivity to the tyrosine kinase inhibitor or not. And I've been burned on this before, even as a lung cancer expert. You really got to look carefully. The other one that's confusing is exon 20. Now, rule of thumb is exon 20 EGFR mutations are generally resistant to tyrosine kinase inhibitors. Don't confuse EGFR exon 20, which is only about 3% or 4% of all EGFR, with HER2 exon 20, which is around 90% of HER2 mutations. So exon 20 mutations in the EGFR domain, again, some are sensitive to tyrosine kinase inhibitors, while others are not. Most of the exon 20 mutations are not sensitive to the EGFR TKIs that are currently approved. So osimertinib, is the approved TKI, EGFR TKI for exon 19 and 21, but it's questionable whether it has meaningful activity in exon 20. Now, to make matters even more confusing, we had data at ESMO for mobocertinib, which is a next generation TKI, which does have activity in EGFR exon 20. It's an oral therapy, and it showed a response rate of 40%. So it may be that we sort this out this way. A patient is a biopsy, we get the report back for our 19s and our 21s, and maybe our sensitizing 18 mutations, we use osimertinib. For our 20s, where we're unclear, maybe we use mobocertinib. So it's very confusing, but the bottom line is not all EGFR mutations are the same, and it makes it very confusing. Again, this is a call to really look hard at your next generation sequencing report. Don't hesitate to phone a friend and get expert advice on whether this mutation will lead to responses to tyrosine kinase inhibitors or not. 19 and 21 sensitive, 18 and 20 generally not, but you got to look within the 18 and 20s to see whether they're truly resistant or sensitive.